Welcome to What's Going On. What's Going On is a new venture for Children's Futures to highlight the positive people living or working in the city of Trenton and the greater Mercer County region. Today on our show, we have Dr. Ruth Perry from the Trenton Health Team. Thank you for being on our show,
Well,
Dr.
thank you
Perry.
for the invitation.
So before we get into the Trenton Health Team, can you tell me a little bit more about your background, what brought you here to Trenton?
Sure. I'm a physician by training, so I graduated from Swarthmore College and Temple University's medical school.
Excellent.
And then did my residency at Medical College of Pennsylvania and was an emergency room physician for about 7 years. During that time, I had my 2 daughters who were 22 months apart, and the rotating shifts weren't working with family life. So for better work balance, I went to work for the Roman Haas Company, which was a specialty chemicals company based in Philadelphia. And I was there for 17 years and had increasing roles of responsibility in environmental health, product safety, occupational safety. And in 2009, Roman Haas was acquired by the Dow Chemical Company. So they wanted me to come with the new company, but that would have required me to relocate to either Plaquemine, Louisiana or Midland, Michigan. And so that wasn't working for me professionally or personally. So I decided to retire and took 18 months off and then learned of this position with the Trenton Health Team and was excited about that work and started working with the Trenton Health Team in April of 2011.
Nice. Now the Trenton Health Team, tell me a bit more about the Trenton Health Team. Who are your partners? What is its mission, its history?
Okay, the Trenton Health Team actually goes back to about 2006 when Capitol Health decided that they wanted to close their Mercer campus to open the Hopewell campus. And so at that time, the mayor, Doug Palmer, convened all the major healthcare players to come together and also contracted with the CATS Consulting Group to come in and really report about the overall health impact of this move, what the health status was of the city. And so the CATS Consulting Group did a very exhaustive study and found that majority of the residents of Trenton did not have a primary care physician. They found that ER utilization was 54% higher than the national average, and that most people were receiving their primary care through the emergency department, which is the most expensive form of care, but the health outcomes were poor given the cost of that care. So after the study, they recommended that the 4 partners, which are now the corporate members of the Trenton Health Team, Capitol Health, St. Francis Medical Center, Henry J. Austin Federally Qualified Health Center, and the City of Trenton Department of Health come together and form what they called at that time a medical home model. And so that's exactly what happened. And in February of 2010, the Trenton Health Team became officially incorporated as a nonprofit group in New Jersey. And we got some funding through the state to begin to help us build infrastructure for the Trenton Health Team, and which enabled them to hire me, and I came on board as their executive director in April of 2011. And so our mission really is to make Trenton the healthiest city in the state, and that we believe that we can be effective in doing this through collaborations across the city of Trenton with a number of community partners, and that if we work together and collaboratively, that we can make our vision come true to have Trenton to be the healthiest city in the state.
Now, these reducing those who frequently use the emergency room as their primary physician is one initiative. What other initiatives is the Trenton Health Team working on?
We actually have 5 strategic initiatives. So one is to expand access to primary care. The second is to continue to do community-wide clinical care coordination, and so that's where we're providing comprehensive wraparound services for individuals who are high utilizers of the hospital or of the emergency department. The third is to engage the community, and there are a variety of ways that we're doing that. The fourth is to use data for managing population health, and the fifth is to become an accountable care organization.
Okay, so were there any models? Because we are Children's Futures. We look into, of course, one of our main goals is to really help the families get healthier in the city of Trenton and the greater Mercer County region. And so we were looking at different models, and we know that Newark, or I believe Newark or Camden, is doing a very similar model where they actually brought in a physician to an area of the city that they know these folks use the emergency room, they're high users of the emergency room, And if we put a physician where they live, work, play, then we're going to automatically reduce the cost that the hospital incurs. I mean, so have you looked at these models, and how are you working with other cities that are trying to do the same thing?
Let me go back to the beginning of our strategic initiatives and kind of go through those, and I'll touch on your question. So in terms of expanding access to primary care, we actually contracted with Dr. Mark Murray, who developed the Advanced Access Scheduling Program for Kaiser Permanente out in California. And what that enables outpatient clinics to do is, through a very laborious data-driven process, to open up their schedule so that they can see patients the same day or the next day. So we rolled this program out across the 7 outpatient clinics within the city of Trenton. So at the City Health Department, the 3 clinics of Henry J. Austin, the 2 clinics at Capitol Health, and 1 clinic at St. Francis. And so it's been really dramatic. At Henry J. Austin, the 3rd next available appointment was around 37 days, and that's dropped to 2.
Wow.
At St. Francis, they didn't really have a schedule. They call it the deli system. Clinic would be open, take a number, and wait. So they've developed a scheduling system, and that they have reduced their 3rd next available appointment down to 2 days. They've also improved what we call physician-patient continuity, meaning that the person will come and see the same physician or the same physician team each time they visit. So St. Francis initially had 0 continuity, and now they're up to 99% physician-patient continuity. So we're very excited about that. So by being able to open up the schedule and give people appointments at the same day or the next day, you can increase their access to primary care and begin to relieve the burden on the emergency department. For our clinical community-wide care coordination, where we're really working intensively with high utilizers of inpatient services or emergency department services, there are hospital-based teams within Capitol Health and within St. Francis, and we also have a community-wide care coordination team that meets monthly. And so there we've identified individuals who are the high utilizers, and we have begun to wrap services around these individuals. So you may have heard a story of a woman we call Lady B, who had 465 emergency department visits in the year 2010. And by having these teams work with her, and also she was homeless, she had numerous medical problems, substance abuse problems, they were able to find her housing, and her emergency department visits dropped from 465 in 2010 to about 12 in 2011. So the model is very, very, very successful, and we've begun to track over this last year through some funding through the Nicholson Grant, how we've been able to reduce emergency department visits and inpatient visits for high utilizers, and both Capitol Health and St. Francis have dramatic results, like 50% reductions in ER utilization, 50% reductions in inpatient visits with a requisite reduction of cost. And what's also very interesting is that Trenton has a high number of homeless individuals, and so we've actually looked at individuals who were homeless. There were about 5 individuals who were homeless that we were actually able to get them into permanent housing very quickly through Housing First. And so when you track their ER visits over the course of 1 year, emergency department visits dropped by 72%, inpatient visits were reduced 100%, and their charges for inpatient were reduced by 100%.
So how can, because the numbers speak for themselves, I mean, they're phenomenal. How can these community partners, such as Children's Future, such as so many other social service agencies in the city of Trenton, really help the Trenton Health team accomplish these goals? Well,
what we've really been doing, and there's several fronts to that. So the 3rd objective is what we're calling community engagement. And so we're doing a unified community health needs assessment. Typically hospitals, outpatient clinics, federally qualified health centers, the city, they all every 3 years have federal requirements to do a community health needs assessment. And so they've been done individually, but they've kind of gone over the same ground. So this is the first time that we were doing this in a unified fashion. So that's very exciting. The second component of that is that we're using PICA, which is a faith-based community organizing group, to take the data that's coming from the hospitals and from the outpatient clinics, as well as community partners such as Children's Futures. You all have been very generous in sharing your data with us, and other community partners have been doing that as well. And then PICO is actually going to the people and asking them to sort of verify and validate this information, and to share their narratives in the healthcare system with us, and to talk about what their barriers are to getting healthcare. And so some of the early results are very, very interesting, because you'll see through the hospital and outpatient clinic data that diabetes or obesity is a significant problem in the city. Well, what's very interesting, when you talk about diabetes to a physician, you think, oh, well, they haven't been diagnosed, or they're not taking their medication, or they're not taking their insulin, etc. But when you talk to the people, the information is a lot different and a lot richer, because it focuses on social issues. So you learn, and we've learned this through some of the work at Kingsbury, well, many times individuals can't get to their primary care physician because they don't have transportation. Or no one has ever explained to them how to use a glucometer to check your blood sugar, how to actually inject yourself with insulin. So it's been a very, 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 very important learning for us that you really need to merge the quantitative and qualitative data and bring that together to be able to then develop a comprehensive plan for the city. So what we're going to do is, this community health needs assessment is funded by the Robert Wood Johnson Foundation and will run for 2 years. And after we collect all this data, we're going to meet with our community advisory board and share this data, and hopefully together with our community advisory board, which has got about 33 unique individuals representing 29 organizations. So again, Children's Futures, the Mercer Alliance to End Homelessness, Greater Trenton Behavioral Health, the Rescue Mission of Trenton, municipal, state government, county government offices are all part of our community advisory board. So to work together to develop a community health improvement plan. So that is the ultimate goal.
That is the ultimate
goal for this process.
Now, I know our time is coming to an end, but I just wanted to give you an opportunity to speak directly to our viewers, directly to these families, to these children that you are serving through the Trenton Health Team and through your community partners, of course. What advice or what can they do to get their children themselves to be healthier individuals?
I think right now that the greatest piece of advice would be to find and identify a primary care physician that you feel that you can relate to for yourself and for your children, and to really work with that individual to help improve your health. If there are any problems, any difficulties that you encounter, please feel free to reach out to the Trenton Health Team. We would be happy to get you plugged in, happy to give you any advice or guidance and to help work with you to do that. But I think that also, we can also offer education services so that to help you better understand your illness, because we're learning that when patients are more informed about their health, how to take care of their health, they will do a better job in taking care of their health. And so we really look forward to being able to partner the medical community and the community as a whole to improve the health of this community.
Great. Thank you so much for being on our show.
Well, thank you very much.
We'll have your contact information on our video and on our website so that they can get in touch with you.
Okay, that's great. Thank you
for joining us today, and that's what's going on.